So a urinary tract infection, or UTI, is, as you can tell from the name, obviously an infection of anywhere along the urinary tract. So anywhere along the urinary tract includes the urethra, as you can see here, the bladder, or if you go up, the kidney as well. Kidney is also part of the urinary tract. So any part of that any infection of any parts of those is called a urinary tract infection. I just want to note that a lot of people, including doctors, when they say UTI, they're referring to a bladder infection of the bladder. And they do this because this is the very most common cause of a UTI. But if we want to be very specific, a UTI can be an infection anywhere along this tract. Now, risk factors for a UTI are any behavior that introduces bacteria into the urinary tract. So things like having sex, because you have all this bacteria around the skin area. When you have penetrative sex, you can risk having the bacteria seed up the urethra into the bladder. Or things like putting a catheter in. So a catheter is a tube that we place through the urethra up into the patient's bladder, because sometimes maybe this patient can't pee on their own, their bladder's not working, there's an obstruction, and we need to empty that bladder. We put in a catheter. But a catheter, as you can see, bacteria can just track up that catheter into the bladder. So that's why we want to take out the bladder as early as possible for patients, because the catheter puts them at risk for urinary tract infections. Finally, next is female gender is also a risk factor. And it's because of females having a shorter urethra. As you can see here, there's female urethra versus a male urethra. Female urethra is much shorter, so bacteria don't have to travel that far to get up into the bladder and cause infection there. Finally, urinary stasis is a risk factor. Stasis of fluid, as you always see in a general pathological principle, if you get stasis of fluid, you're at risk for an infection. For example, in the gallbladder, if you have stasis of the bile in the gallbladder, you're at risk for a cholecystitis. So, any behavior that introduces bacteria in the urinary tract, female gender, urinary stasis, all risk factors. Now we're going to go over into cystitis, and this would be the infection of the bladder itself. So this is what a lot of people commonly refer to as UTI, but if you want to be specific, it's called cystitis. And that cyst is what we use to stand for the bladder. So things like if you have a cystectomy, then ectomy, remember, means removal. So removal of the bladder, that's for bladder cancer, cystectomy. And here it's cystitis, infection of the bladder. And E. coli is the most common bacteria that causes this infection. Staph saprophyticus is associated with young sexually active women, but even in this group, E. coli is still the most common bacteria. Now, the symptoms you're going to get, what symptoms are you going to get if you have an infection of the bladder? An infection here, you're going to get, first of all, it's going to be discomfort, right? And where's the bladder? The bladder is located in the suprapubic area. So if you press down, you can find your pubic bone, and right above that pubic bone, that's where your bladder would be. If you press on that area in a patient with a cystitis, it's going to be discomfort. And then the other thing is you're going to have irritated urinary symptoms. So what does that mean? Irritated urinary symptoms are threefold. It can be dysuria, which is burning with urination. Dysuria. You can have frequency, so peeing more frequently than usual, or you can have urgency, so you have sudden urges to pee. And that's just because this infection causes irritation of the bladder. Irritation of the bladder causes it to contract, and you get sudden urges to pee. You have to pee more frequently because it's contracting more frequently. And then, of course, inflammation causes just pain and burning. So those are your irritative urinary symptoms. Now, the other key thing is usually there are no systemic symptoms. So systemic symptoms, what do we mean by that? Systemic symptoms of infection, just basic things like fever, chills. That's what happens when your inflammatory markers, the cytokines, get into the blood and they go to the brain. You get fevers, chills. But why would a cystitis not have that? You have all this infection in the bladder. Why would cystitis not have systemic symptoms? Because all this inflammatory stuff is stuck, it's trapped in the bladder, it's contained within the bladder in the urinary tract, and it can't go into the blood, okay? Remember that this urine doesn't mix with the blood. It's already done that. It's gone through the kidneys, and now it's in the bladder. It does not mix with the blood, so you don't get any systemic symptoms. Last thing I want to note is we talked about this is irritative urinary symptoms. I always want to draw back to something like BPH, and there's something called remember we talked about obstructive urinary symptoms there. So what were the obstructive urinary symptoms? This is just just to relate different things. Obstructive urinary symptoms, just basically a blockage of the urinary system. So things like incomplete emptying, you have to strain to void, so you have to push really hard to pee. There's dribbling. So those are obstructive. This is irritative. So these are just different classifications of urinary symptoms. Now, Lab findings, what you will see is on a urinalysis, so it's an analysis of the urine, you would see positive leukocyte esterases, you can see nitrites, and white blood cells. So, nitrites you see in gram-negative. So gram-negative organisms, and this is because gram-negative organisms, they convert nitrate into nitrite. If you don't have gram-negative organisms, you don't get that conversion, you don't get nitrites. And white blood cells just because they're responding to infection. Now, I want to add that this is none of this, presence of any of these is not indicative of a urinary tract infection. This is a clinical diagnosis. The whole diagnosis is based on signs and symptoms of cystitis. So what do we say were signs and symptoms? Irritated urinary symptoms and suprapubic discomfort. And then the findings on your urinalysis can help support your diagnosis, or even a urine culture would be very supportive. But the key thing is you have to have presence of symptoms. Because if you have a patient that grows out bacteria in the urine and they have no symptoms, it doesn't mean they have an infection. They can just have bacteria hanging out in the bladder. We call it colonization. They're just hanging out, they're living there, but they're not causing any problems. So you need to have symptoms. You need to have symptoms, and then you can support your symptoms with these lab findings to get a diagnosis of cystitis. So that is cystitis. Now we're going to talk about acute pyelonephritis. So this is an infection of the kidney. Okay, infection of the kidney. We just talked about infection of the bladder. Now this is infection of the kidney. And usually this arises from an ascending urinary tract infection. So ascending infection in the bladder, so ascending cystitis. So you have infection in the bladder, and then it can ascend up the ureter and then go into the kidney and cause problems. So usually, risk factor in children is vesico-ureteral reflux. Remember what vesico-ureteral reflux was? So vesical is the bladder, and then ureteral, so your reflux of urine up into the ureters, which shouldn't happen. And this is obviously a problem because if you have bacteria in the urine and it gets refluxed up, you're just like spewing bacteria and urine up into the kidney and you're causing problems. So, symptoms of acute pyelonephritis. You get the same symptoms as cystitis. So what was that? What did we say? We said it was suprapubic discomfort. Actually, in this case, it wouldn't be suprapubic discomfort, but you would have irritated urinary symptoms. Okay. And then so where would the kidney be? It would be in the flank, so you would have flank pain. So you have flank pain, irritative urinary symptoms. What do we say was irritative urinary symptoms? We said it was burning with urination, urinary frequency, urinary urgency. And then you're going to have systemic symptoms here. So systemic symptoms were things like fever, chills, nausea, vomiting, increased white blood cells in the blood. And why was that? I told you that in cystitis there's no systemic symptoms because these inflammatory factors can't reach the blood. But in the kidney, with the glomerulus, we have all that interface between the blood and the tubular filtrate. So if you have an infection here, all these inflammatory markers can go into the blood and cause systemic symptoms. And I just told you about flank pain. So irritated urinary symptoms, systemic symptoms, flank pain. So if you have systemic symptoms and irritated urinary symptoms, you know it's probably a pyelonephritis and not a cystitis. Okay, if you have the irritated urinary symptoms but no systemic symptoms, so no fever, no chills, then it's probably a cystitis. Okay, that's an important distinction. Now, and then going back to the flank pain, what physical exam findings would you see in this acute pyelonephritis? Remember, the exam finding would be the positive costovertebral angle tenderness. Alright, so we talked about acute pyelonephritis. Let's talk about chronic pyelonephritis now. And this is, you basically get scarring and intimofibrosis of the renal interstitium and tubules, and that's due to recurrent episodes of acute pyelonephritis. So recurrent inflammation, obviously inflammation leads to fibrosis, leads to scarring, and then fibrosis and scarring basically means the kidney doesn't work as well. And the reason why you would get recurrent episodes of pyelonephritis is you have some risk factors for kidney infection. I told you one risk factor in children was vesico-ureteral reflux, so that's a risk factor. And then obstruction in adults, so something like BPH. BPH obstructs the urine outflow, so you have urine here. And let's say this is our bladder, this is the ureters, and this is our kidney. So if you have obstruction here, this is a BPH. BPH obstructs the urine outflow, then urine can back up into the kidney, and then you have, what did we say was another risk factor for urinary tract infection? We said if there's obstruction, the urine's not flowing out, there's urinary stasis, that's a risk factor for urinary tract infection. So that's why obstruction in adults can lead to recurrent episodes of pyelonephritis leading to chronic pyelonephritis. So that's our overview of urinary tract infections. Again, this is just scarring from chronic pyelonephritis. Acute, the key difference is systemic symptoms. Cystitis, you have to have symptoms. You can't just rely on the lab markers. There's no systemic symptoms, and that's it.